Did you know that knee swelling affects millions of people and it can often be successfully treated at home? As a specialist physical therapist, I often get asked what activities are safe to do with knee swelling and which ones should be avoided. So today we're going to talk about what is knee swelling, what causes knee swelling, what you should and should not do with knee swelling, and stay tuned to the end because we are going to discuss, does elevating your knee actually help with knee swelling? All right, so what is knee swelling? Well, you see, the knee joint is made up of the tibia, which is the shin bone, and the femur, which is the leg bone. And surrounding this entire joint is a knee joint capsule. So the shin bone and the leg bone are inside this capsule, and you can think of it kind of like a balloon because it can expand and contract. Now, inside you also have ligaments, you have the cartilage that's lining the bone surfaces, you have a lot of things going on that all live within this knee joint capsule. Again, like the balloon. Now, the knee joint capsule can expand to accommodate some extra swelling or fluid that can happen in the knee joint. However, it can only expand so far before it starts to become painful. Sends information to the head through the nerves and says, hey, there's something wrong going on here. And the nerves respond with that pain sensation. So what the swelling is really telling you is that there's something within that capsule that's not going correctly, which leads to what causes knee swelling. Well, most commonly there's an injury, a fall, motor vehicle accident, sports injury, or something that you can point to and say, oh, it's when this happened that I got some swelling. If that's not you, you may have an issue with poor biomechanics, which means your knee is not moving correctly while you're doing functional activities. You may have a problem that's inside your joint. This could include like a meniscus injury or arthritis. It could be due to overuse, so it could be that you're not doing a new activity, but you've increased how much you're doing an activity, and that's caused a little bit of knee swelling. Or it could be due to prolonged pressure on your knees, such as when you're gardening or cleaning house. If you're on your knees for a prolonged period of time, that can cause them to have some swelling. In fact, I have a not so funny story about when that happened to me. So on Saturdays, I go for a long run in the morning, then I clean house, then I go and run errands. And a couple of years ago on a particular Saturday after cleaning house and errands, I decided to kneel on a tile floor for hours in order to wrap Christmas presents. Friends, I could barely get up off the floor after I was done. Now, if you've been around this channel for a while, you know that the thing I should have done was walked around and done some gentle motion before I went to bed, but no, I didn't. I was tired, so I just went straight to bed. And when I woke up in the morning, my knees were so swollen. It was hard to even be able to put my feet on the floor because my knees hurt because of the swelling. So if that sounds like something you've done, know that I do it too, even though I know better. So what should you do in order to reduce knee swelling? Well, the first thing I'm going to talk about is super controversial right now, but I am going to tell you that you should ice your knees. There's a lot of controversy around, does this actually decrease swelling or not? And I'm not going to get into that because the research is not 100% clear. But what I can tell you is that icing will help to reduce your pain, which will make it easier to do step number 2. Which is, I want you to do active movement to tolerance. So I want you to move around as much as you can without increasing pain. Now, swelling causes pain. So I understand that there's probably going to be a little bit of pain while you start moving. However, we don't want to increase the pain because that means that we're actually increasing the swelling. That may mean that we're actually doing too much movement. So it may be that you're sitting in your chair, you ice for 5 minutes, and then you may just sit there and try to straighten your leg and bend your knee. straighten your leg, and bend your knee. For right now, that may be all you can tolerate. For you, you may be able to get up, walk around the house a little bit more, get a little bit more of that active contraction of the muscles, which will help to decrease the swelling. Or for you, you may be able to go and walk further and get more blood pumping, get some cardiovascular movement, which will help to decrease the swelling in the knee, which will decrease the pain, which will help everything move more correctly. And one thing that I want you to be really careful with, particularly when it comes to movement, is making sure that you're not increasing the swelling. So this can happen if you're doing too much activity. So in general, I'll find that people have knee pain and they'll do some icing, it'll make things feel better, and then they'll do a crazy amount of walking or yard work or something like that because they're trying to get it in while their knee feels better. However, that increased motion actually causes increased swelling, and at night they tend to find it very difficult to move because that knee joint has swollen up again. The other thing that can cause increased swelling is walking on uneven surfaces. So this would be grass or gravel or a trail or anything like that. Uneven surfaces actually cause increased strain to the knee, and it's good in general. We need to challenge our knee with that in general, but not when it's swollen, because when it's swollen, we do not have that good joint awareness. You see the joint capsule has expanded to its absolute limit. We don't have good awareness of where that joint is in space, so we don't want to challenge it with something like uneven surfaces until the swelling has gone away. You also want to avoid any high impact activities while you have the swelling for the same reason, in that you don't have those good joint biomechanics or awareness. Along with that, please avoid any sports types activities, especially anything that involves cutting or pivoting. Again, that knee joint is swollen for a reason. We don't want to aggravate it, but also we don't want to challenge the knee when it's swollen because we don't have that good awareness of where that knee joint is in space. Before we discuss the controversial topic of does elevating really help to decrease your knee pain or swelling, we have a goal of hitting 1 million subscribers by the end of the year. So if you're getting value from this content, please hit that subscribe button. All right, should you be elevating if you have knee swelling? Well, this is going to be a controversial answer, much like many answers are on this channel. And the answer is, if you can elevate your knee, it is a good idea because it may help with the knee swelling and it may help decrease the pain. However, if elevating causes you to not have time to do something like icing or active movement, I would not bother with it, because putting your knee in an elevated position does put it in an ideal position for the swelling to move out and the lymphatic system to be able to work more correctly. However, what we know about the lymphatic system is that it works best from active muscle contraction and relaxation. That's what actually causes the fluid or the swelling to be able to move out of any joint that's irritated. So you're going to benefit more from movement in order to decrease the swelling, as long as it's not too much, because too much movement increases the swelling, than you are from elevating your knee. However, if you're able to elevate your knee while you're icing for 5 minutes, and then you do some active movement to move that swelling out, well, that would be a great idea, because why not elevate it while you're icing? Because you have to be sedentary while you're icing pretty much anyway. And hey, it might help a little bit. But you should really know that the RICE method, rest, ice, compression, and elevation, has been debunked for a while now. In general, that is not the best idea to deal with knee swelling. The one exception to that, I would say, is within the first 24 to 48 hours after an injury. If you have a knee injury that occurred and that's what caused the swelling, I would implement the RICE protocol maybe for 24 to 48 hours. Again, while that knee joint is really swollen and you don't have that good awareness of where that knee is in space, at that point, activity might be a little bit concerning, or even walking might feel a little unstable and unsafe. If that's the case, then the RISE protocol for the first 24 to 48 hours would be okay. However, after that, and definitely after a week, you should not be depending on the RISE protocol in order to help decrease your swelling. It just doesn't work in a chronic type of state. Looking for more tips to help with your knee, then I'm going to encourage you to download our free ebook. We'll include the link in the box below. And if you're looking for ways to decrease stress in your knee, check out this video over here.